let's talk about why you must address something called endotoxemia to have full control over health, but specifically here, coronary disease risk. That is, risk for heart attack, sudden cardiac death, the need for procedures like stent implantation or bypass surgery. So what does endotoxemia have to do with heart disease risk? Well, it's such an overwhelming process that influences just about all aspects of your health. So I hope by now, if you've been following my conversations here in my YouTube channel or my Defiant Health podcast or my blog, WilliamDavisMD.com, or my books like Super Gut and Wheat Belly and Undoctored, I hope you've come to recognize that the world doesn't really care to prevent heart disease because it makes a lot of money. It is the number one source of revenue for hospitals. At least half of all their revenue and profit comes from addressing heart disease. And that's why your hospital may have added an $80 million wing for cardiovascular care, but it doesn't really talk to you about genuinely effective ways to prevent heart disease. It pays really well. When I practiced interventional cardiology years ago, doing such things as implanting stents, aborting heart attacks, those kinds of things, it was very profitable, extremely profitable. But it was also disgustingly dishonest because there's almost no attention being paid to how to prevent heart disease beyond the lip service provided by addressing such things as cholesterol, saturated fat, statin cholesterol drugs. These are useless efforts that have nearly no effect whatsoever in reducing your risk for heart disease. The sad truth is that there are many things you can do, very effective ways to address risk for heart disease and essentially eliminate risk from your life. But it has nothing to do with saturated fat, has nothing to do with statin cholesterol drugs, has nothing to do with LDL bad cholesterol, all those boogeymen that have done nothing to reduce the incidence of cardiovascular disease in the country. So over 80 million Americans, for instance, take a statin cholesterol drug, yet it has had, you would think that they were truly effective, as they claim, there would have been a broad and significant reduction in cardiovascular events. There has not, because they do not work. They have such minimal effects as to be useless. And of course, you likely know that taking a statin drug increases the likelihood of developing type 2 diabetes significantly because it worsens insulin resistance. But anyway, back to the primary topic, endotoxemia. What is endotoxemia? Very simply, when microbes overproliferate, that is fecal microbial species, the ones we really don't care to have, like E. coli, Salmonella, Campylobacter, Pseudomonas, mostly of the so-called gram-negative species, but also some gram-positive species like Staphylococcus, Streptococcus, and Enterococcus. When they're allowed to overproliferate, as they do if you've taken, for instance, a course of antibiotics that kill off beneficial species, because beneficial or probiotic species are very susceptible to common antibiotics. So you take an antibiotic, it kills off lactobacillus species, bifidobacteria species, fecalibacterium species, other beneficial species. That allows the overproliferation of these fecal microbial species because those good species were suppressing them. When you lose the good species, the unhealthy fecal microbes overproliferate. And in a huge number of people, at least half the country, at least half the U.S. population, has allowed these fecal microbial species to ascend into the small intestine, the 24 feet of small intestine. The small intestine is very ill-equipped to deal with that because these fecal microbes, trillions of them, in 24 feet of duodenum, jejunum, ileum, the small intestine does not have the defenses like the colon does. The colon has a thick two-layer mucus barrier, small intestine, single-layer mucus barrier. Small intestine is by design very permeable because that's where we absorb nutrients like amino acids, fatty acids, vitamins, minerals. So the small intestine, less protected, more permeable. When you have fecal microbes, trillions of them, they only live for a few hours at a time. They don't live for very long. When they die, they release their components into the intestinal lumen, into the contents of the intestine. And one component in particular called endotoxin or lipopolysaccharide endotoxin, which is a component of those gram-negative species, those E. coli, Salmonella, etc. That endotoxin enters the bloodstream, and that's called endotoxemia. And we know now, the evolving evidence tells us that is a major risk factor for heart disease in its various forms. It could be coronary disease, sudden cardiac death. angina. It could be atrial fibrillation. So it's becoming clear that endotoxemia is a major risk factor for multiple forms of heart disease. And endotoxemia and this infestation of the small intestine, small intestinal bacterial overgrowth, SIBO or SIBO, is a very common risk factor, very common situation, people who have coronary disease, because endotoxemia is very inflammatory. It causes inflammation. It could be in the brain as dementia, or in the skin as rosacea, psoriasis. It could be in the liver as fatty liver. It could be in the prostate as prostate disease. It could be in the coronary arteries, where it leads to coronary atherosclerosis, eruption of plaque that leads to heart attack, sudden cardiac death. So endotoxemia, major risk factor. Now, how do you know if you have it? Well, tough, because the primary test for endotoxemia is measuring that lipopolysaccharide, endotoxin. But that test is not clinically available. It's only a research tool, and there are a variety of reasons for that. One of the problems is it tends to vastly underestimate the severity, because all those species I mentioned that overpopulate in SIBO, in the small intestine, have different endotoxin structures. So one test that uses an antibody specific for only certain types of endotoxin will underestimate. So it's not clinically available right now. So we have to do this indirectly. One way would be to test your breath for hydrogen gas. And one of the ways to do this is this device here, the AIRE device, AIRE. This is the original that measures hydrogen gas. This is a more recent one that measures hydrogen gas and methane. These are bacterial products, and there's a specific way to do this. If you want to know how to use it, see my Super Gut book. I wouldn't rely on the company's advice because they don't really fully understand what they're doing. They're a good company. I know the inventor, Dr. Angus Short from Dublin, Ireland. He's doing his best to try to popularize this idea. But there's a better way to use it, and that's detailed in my book, my Super Gut book, because there's a dietary prep in the preceding 12 to 24 hours. Then there's a baseline measurement. It's a 0 to 10 measure for hydrogen, for instance. 0 being no hydrogen, 10 being tons of hydrogen gas in your breath, because you don't produce hydrogen, but bacteria do. Some bacteria do. So we're going to get a baseline measure, let's say 1.2, real low, and then challenge with a fiber that's consumed by bacteria, good and bad bacteria. I use inulin in laboratories and clinics, the ones that even understand what this means. We'll use glucose or lactulose, which I think is a bad idea because not that many microbes can consume lactulose, for instance. But inulin is widely metabolized by a broad array of microbes. It's a better challenge. So we take a couple of teaspoons of inulin, like in your coffee or other food, eat what you want, and then test every 30 to 45 minutes over 90 minutes, and a rise of 4 units or more on that 0 to 10 scale on the AIRE device is a positive. So let's say you start at 1.2, you have your coffee with a couple teaspoons of inulin, maybe you put some cream, you had some eggs, whatever, and then you test at 45 minutes, now it's 9.8. More than 4 unit rise. You have bacteria living in your small intestine, because that 90 minutes is too fast to have reached your colon 24 feet down, where producing hydrogen gas is expected and normal. But producing it early, within 9 minutes, is abnormal. And that means you have microbes, those nasty fecal microbes, living in your small intestine. And now producing endotoxemia, a risk factor for numerous conditions, but also for coronary disease, right? And so, how do you get rid of this? Well, what if I said to you, the solution is to surgically remove your small intestine? Well, you should say to me, what? You better be damn absolutely 110% confident that this is the situation. But what if the solution is something that looks and smells like yogurt? It's not yogurt, right? I call it yogurt because it looks and smells like yogurt, but it's not yogurt. It's certainly not the garbage you buy in the grocery store. It's something we're going to ferment using human microbes, okay? We're not going to use Lactobacillus bulgaricus or Streptococcus thermophilus. Those are conventional yogurt microbes that do almost nothing for health. We're going to use human microbes, but specifically microbes that have certain characteristics. Characteristics that include colonization of the small intestine. That's where all this occurs, right? And produce what are called bacteriocides, natural antibiotics effective in killing those fecal microbes. This is why the pharmaceutical industry is actively pursuing this question of bacteriocins, because they're hoping to develop drugs based on mimicking or echoing the structures of these bacteriocins, because we know with confidence those bacteriocins are very effective antibiotics. So we're going to get species. I chose 3. Lactobacillus rhodori, Lactobacillus gasseri, both colonize the small intestine, both champions at producing bacteriocins, mostly effective against those gram negatives. Now, my original recipe used Bacillus coagulans, a spore-forming microbe, but I've since switched over to Bacillus subtilis just because we found that coagulans is not that reliable in getting high numbers when you ferment it as yogurt. You can ferment in other vehicles, but dairy is not the best vehicle for proliferation of Bacillus coagulans. So we've switched over to Bacillus subtilis. It looks like subtilis, but subtilis, which has bacteriocins effective against both gram negatives and gram positives. Because some people have SIBO that's more dominant with, say, those gram positive species like Streptococcus or Enterococcus. So we want the full spectrum. We co-ferment all 3, or more recently, a lot of people are doing them individually, because when we co-ferment, we don't know what the relative changes numbers are as you make subsequent batches from a previous batch. There's probably going to be a shift in numbers we have not yet tested. It requires DNA testing to determine, let's say, what the composition is of your 10th batch. We don't know. So if you really want confident efforts here, make each one individually, and we consume maybe 1/4 cup of each, so that's 3/4 of a cup, per day for a minimum of 4 weeks. And you'll see, if you were testing hydrogen gas, you'll see it normalize almost always after 4 weeks. One odd twist. Lactobacillus rhodori will cause hydrogen gas production. Hydrogen gas itself is not detrimental. It's just one of the behaviors that some bacteria have, and it turns out our good friend, Lactobacillus rhodori, also produces hydrogen gas. So if you're going to use the air device, stop the rhodori for a minimum of 2 weeks after your 4-week or longer course, then test, and you can see if you're negative or not. You don't have to have the air device. It's a handy thing. It's a very nice device to have to measure or to look for recurrences later on, because the symptoms of recurrence can be different than the original symptoms, because the bacterial composition of SIBO can change over time, especially with recurrences. But anyway, if you have reason to suspect you have this process, you have coronary disease, that tells you have SIBO. If you have food intolerances, you know you have SIBO. It could be histamine intolerance, it could be legumes, could be nightshades, could be fruit and fructose-containing foods, could be any number of food intolerances. Those are all signs of SIBO. Or it could be a condition that is so highly associated with SIBO that you're pretty much sure you have it. Fibromyalgia is one. Irritable bowel syndrome is another. Obesity is another one. Type 2 diabetes, an autoimmune condition, a neurodegenerative disorder, sleep apnea, irritable bowel syndrome. These are all conditions so highly associated with SIBO that you could, because the solution is so benign, right? It's something you make in your kitchen. And we don't have to talk about side effects. The only side effect by making, I call it SIBO yogurt, by the way, the only side effect is from the initial die-off. That is, you're taking these microbes, right, as these yogurts, and they kill off those invading fecal microbes in your small intestine. You can feel that as a flu-like syndrome, low-grade fever, muscle aches, fatigue, dark thoughts, sleep disruption, nightmares. Usually does not last more than a few days, occasionally longer if you have SIBO really, really bad, like people who've taken antibiotics for years, they have SIBO really bad. But that's the only side effect, and you can reduce those unpleasant effects by reducing the quantity of yogurt you're consuming, maybe only a tablespoon of each at the start. Or you can take a capsule, 1,000 milligrams of activated charcoal, works within 15 minutes and binds the endotoxin. You only want to do that as needed because charcoal is not that good for you. It does bind nutrients as well, so use as needed. But we use the 3 microbes, and so far it has exceeded my expectations, wildly exceeded my expectations in normalizing SIBO. And I would urge people to continue consuming that SIBO yogurt, or at least the rhodori and gasseri, for the rest of your life. maybe only 3 times a week or so, because it does take up at least temporary residence, not permanent, but temporary residence, and it discourages the frequent recurrences. Now, we don't have to talk about side effects aside from the phenomenon of die-off, and you get all these other benefits from those microbes, like smoother skin, restoration of youthful musculature, amplification of your immune response, increased libido. Older guys can have a rise in testosterone. Older females will have a restoration of youthful vaginal moisture and sensation. And all the effects from oxytocin, that is, an increase in empathy, generosity, desire for human companionship, and the acceptance of other people's opinions. So if we don't have to talk about side effects aside from the die-off phenomenon, why not do this for the rest of your life? Because you're going to look and feel younger, right, from the combination of those 3 microbes. So if you don't know how to do this, or you want to know, see my Super Gut book, see my blog, my WilliamDavisMD.com blog, join my Inner Circle, where it's innercircle.drdavisinfinitehealth.com, where we talk about these things. We talk about some of the difficulties people encounter making the yogurt. It's really so simple, but people get tangled up in some of the details. And of course here, this YouTube channel, to see how we make it. It's very, very simple. I show you where to source the microbes. I show you how to ferment it, what kind of devices you might use, a yogurt maker, a sous vide device, or an Instant Pot, how to use those devices to make these yogurts. And you have the key to magnificent health, including dramatically improving your risk for heart disease.